Hello, everyone. Again, my name is DeShannon, and I am your host. So now it's Friday, so we normally have coveted conversations. But instead of a coveted conversation, we're going to have a critical conversation. We're talking about COVID-19, the vaccine, and how it's affecting people that live in our community. I have some amazing guests. But if you're just joining us, go ahead and share this. Go ahead and share it now because there's somebody that needs this information. I know y'all watched the news. I know y'all read things. Social media is a buzz. I know what we're saying when no one else is listening. But let's get some good information. If you're just joining us, we're Community Social Justice. We are dedicated to bringing you great information all the time, every time. We have some amazing guests today, people that we have vetted to give you the very best and latest information. We're talking about healthcare professionals who do this day in and day out. We don't want you to be misinformed. We don't want the latest Twitter feed to give you the best information. You can always come to Community Social Justice and get the right information for our community. So go ahead and share this. But again, my name is DeShannon, and I can't wait to have this critical conversation. Now, if you don't know anything about me outside of Community Social Justice, I've been in healthcare a very long time. So I have a lot of colleagues. I have a lot of friends that work at the CDC. I have a lot of medical professionals in my circle, and we talk all the time. So we're going to do this conversation, this critical conversation with my new friends that I'm going to bring on, introduce you to them, and let's get started. The first person I want to bring on, she is a medical professional, Dr. Curry. Can you say hello to Community Social Justice?
Hello. So nice to be on with you and have this conversation. I'm excited.
Okay, Dr. Curry, for people who don't know you, tell them a little bit about you.
Well, my name is Dr. Jocelyn Curry. I am a podiatrist, so I am a foot and ankle surgeon. I treat all ailments below the knee, from the basic ingrown toenail to bunions or hammer toes to ankle fractures. I've been in private practice for 10 years, and I'm originally from Georgia. So it's been great being in private practice back in my home community. And I enjoy what I do every day.
Okay, so I know everybody's going to want her contact information because if you're like me and have worn heels all your life, you might have something to say about that.
I do. I see a lot of patients just like you. Yes.
But our next guest is a healthcare administrator. Mr. Williams is going to tell you a little bit about himself. Say hello, Mr. Williams.
Hi, how you doing? Glad to be here. Excuse me. My name is Vincent Williams. I'm a healthcare administrator. I've been in the healthcare field now for 14 years in women's health at Greater Atlanta Women's Healthcare. It's a women's health facility located in Atlanta, Georgia. Like Dr. Curry, I'm originally from Atlanta. I grew up in DeKalb County, and I'm ecstatic to be here and to be in practice here in my hometown as well.
Awesome. Okay, so we bring the best of the best. We are going to make sure you get the right information. But now remember, I told you we're having a critical conversation. All right. January 20th of 2020, our first case. It has been a year now. One of the last stats I saw, over 400,000 people have lost their lives to this thing.
Mm-hmm.
We have a vaccine by 2 different manufacturers, but we want to talk about what that means to our community. And I'm going to start talking about the stats because I like stats. So on the CDC website, I encourage everybody to go there. If you go and you look at the stats, brown and black people are 3 times as likely to die. I want to talk about why do we think that is. So, Dr. Curry, I'm going to start with you, and then Mr. Williams, I want you to follow up with that.
Well, it's so disheartening to hear stats like that. But on the other hand, it's not surprising. Seeing the kind of patients I treat and the ailments I treat, we are often, our community are the last ones to come to the doctor. We wait until the very last minute after we've tried every home remedy out there, everything that our neighbor and barber and friend told us to try. Then we'll finally come. I have some patients I call frequent flyers who come to me at the very last minute and want me to save their foot. And I was like, well, why didn't you just come a few weeks ago, a few months ago? And so with that mindset, that in general health in our community, it's not that surprising that COVID would take us out faster, and with more pain, and at such a high rate. I think it's not necessarily a genetic thing. I think it's just more about the community and the mindset and how we view medicine and how we view treatments, and even honestly how COVID was viewed in the beginning. You know, we did hear a lot of the misconceptions in the beginning that it didn't affect us like other people, or that we were somehow immune, that it was a disease of, you know, from Europe or from China, or it didn't really, it wasn't going to affect us until it did. And then everyone was on high alert. And unfortunately, by then it was almost too late. So with all our comorbidities of diabetes and kidney failure and hypertension, once COVID jumps on with all those other ailments, it's really hard to come back from it. And that's definitely what I'm seeing.
Right.
Mr. Williams, you want to add to that?
I definitely agree. You know, you think about the prevalence of those comorbidities that we have in our community, weight, diabetes, these different things. And when you put COVID in that mix, it's a recipe for disaster, you know? And I think to kind of echo what Dr. Curry said, it's part of our culture, so to speak, just to push through, just to continue to push through. You'll be okay, you know. Sip some ginger ale, go sit on the couch, you'll be fine. That type of thing. What I mean, and that in turn makes our culture and our community less inclined for general health checks and things like that. And you know, that's kind of where we are now, and it's very, very disheartening.
Well, let's go back to the beginning. We talk about that's our community or that's our culture, and we all have the same things. You know, something happened to you, you take 2 baby aspirin and you go take a nap. You know, Vicks will save everything. We'll put Vicks on the bottom of our feet for children coughing. We'll put it on our back, our nose, our chest. We will listen. You got every person of color that I know. If you don't have anything, you got aspirin and you got Vicks. So, you know, we laugh about that, but those are commonalities. But let's go back to why we do wait till the last minute, or some of the things that may have caused us to be gun shy when we're talking about whether it's a virus, whether it's going for healthcare in general. So I want to take us back a little bit to some of the things that maybe not as well known that we were literally experimented on. And we've all been in healthcare for a very long time, so we know these stories, but some people don't. So Dr. Carey, you know, when you're talking to a 70-something-year-old man that remembers the Tuskegee experiment, how would that play into that? And Mr. Williams, since you're in women's health, let's go to North Carolina, where the sterilization was still going on even after I was born. Mm-hmm. And these women are still alive right now today, and they're just now, you know, saying they're sorry for that. I want you to talk about that, and Dr. Carey, about what that does to a community when you're talking about healthcare. We'll start with you, Dr. Carey.
Yeah, I have definitely run across that. The older patients who have a distrust for medicine. I think that seeing a young Black or female face, a Black physician in general, does help with bringing some trust to the health community in general, and just believing what I'm saying to them. But the older generation is hard to forget. It's hard to forget what has happened when you are given medications unnecessarily or not given medications that you need. And then, of course, looking at the Tuskegee experiment, those who are around and know what happened, and just aren't always keen to believe in medication can help. A lot of times it's not always about medicine. It can be about diet changes. I know as a growing up with my mother, she was from South Georgia, so they grew a lot of their food. They had their own chickens and their own pigs, and they had their own source of food right handy to them, so they didn't have to rely on a Kroger or Publix to get their food that was more processed. So moving from that mindset of relying on your own garden, where we know what's in the garden, we know what's in the soil, we know what's feeding it, what's fertilizing it, to not knowing where food comes from, the pesticides that are on it can be also are huge factors in our health. And that changes how people respond to medications. Um, Trying to get them on medicine to get blood pressure under control, get the diabetes under control, to a point where they can rely on a healthy diet to keep these diseases manageable, where you don't need the pharmaceutical medications to keep you healthy. But in the light of trying to convince an older patient that what I'm saying is true, it takes a lot of coercing. It does. Sometimes I just have to get real with them and come out of doctor mode and come and turn into a friend, or depending on their age, like a daughter, just talk to them real. Like, I've seen this happen. If you don't make these changes, 1, 2, 3, 4, you will lose your toe. You will lose your foot. This will happen because I've seen it, especially not being in practice for 10 years now. I've seen the good and the bad. I have the patients who have listened to me, and they may have had an amputation, but they're still walking and moving and doing great. And I've had those that I've lost and had to send, a flower arrangement to their funeral, which it hurts me to my soul to ever when it gets to that point. But I try to be that encouraging doctor, not one that's always going to down a patient if they don't follow my rules, because I know that has been some people's experience, where doctors are negative all the time, and it's, well, if you don't lose weight, this is going to happen. And it's not always about being negative. We know weight is a factor, and that's a factor in American society in general, not just Black community. But trying to come to patients in a different light and not be negative about their health, and show them the positive side of things, even if things don't look so great right now. You're muted.
I didn't hear you, Deshaun.
I am so sorry. I just wanted you to talk about the women's side of that. And we know, with you being in women's health, even when we're talking about childbirth, Black women are more likely to die doing routine things than any other race of people. And so and they know that. Again, we talked about, in Winston-Salem, they're sterilizing women well into the 70s. They're doing things to Black women. How do you think that may have affected us and what we think about this virus?
Well, of course, those things just inherently sow distrust in our community. I think, and I guess let me preface it by saying I am not a doctor. I am an administrator. I handle the business of medicine. But I do know, just, witnessing what happens right outside of my window, that it matters to have a connection with your healthcare provider. We shouldn't treat healthcare like going to a restaurant, ordering off a menu, that kind of thing. You want to make sure you have a personal relationship with your physician. That way you can know that this person has my best interest at heart. And we see that time and time again. The office has been in practice for over 30 years. We've delivered mothers, babies, and grandchildren. And it's amazing to see that. It is amazing to see that. And it's about establishing a connection and a relationship with your provider. My grandmama used to always say, anything that has man's hands in it has the potential to have negativity in it, you know? And so those unfortunate events, the Tuskegee experiment, what happens with the sterilization, those things are awful. But you can, we now have the ability to connect with your provider. You can choose your provider, and and make a connection and make shared decision making. And I think that's very important. I think, I think that is of the utmost importance. And when we look at racial disparities and things like that, you want somebody who not just can empathize, but sympathize with what you're going through. You want a physician who can say, I know from experience what you're feeling. Not, I've read this in the book and it says do this. That's my personal opinion, and I think that helps to overcome some of these horrific atrocities in the past.
Well, I wanted to continue on that vein, and I want to ask you guys, how important is it to gain the trust of our community with people that look like the community? Because I'm not from Georgia. I've been in North Carolina for a long time, and was still considered the first Black CEO, the youngest first. It's so I was maybe the only person of color, and you'd see the little old lady walk by the office. I'm like you, Mr. Williams. We're on the administrative side.
Right.
To ask me, is this okay? Is this all right? Because the people who were treating her did not look like her. And so you inherently don't know, is this going to hurt me or not? So let's get back to this virus. A lot of people are still unsure what this virus is.
Mm-hmm.
And so, Dr. Curry, I want to just ask you what it is, and then we're going to get into what does it look like to protect ourselves? What does it look like to kind of protect what we know, our family, our friends? And Mr. Williams, we definitely share the same vein, and we're going to talk about cost and why people think that, we want to just talk about how this virus is affecting us. But really, Dr. Carey, what is the coronavirus?
Well, let me preface by saying I'm not an infectious disease doctor. So viruses and bacteria are not my specialty, but from what I've researched and what I've read, it's a coronavirus, which is a family of viruses that have been around for a long time. There are other mutations of it that show up in different diseases, different ways. But this particular one has been named COVID-19 because of when it was found, 2019. This particular strain of coronavirus has been exceptionally deadly because it's unknown. They didn't know about this mutation when it came over from China. And the best thing they can figure out in the beginning is, to sanitize. And they, of course, and they figured out it was them respiratory droplets. We want to cover up from that. So that's where the masks come from. And then, of course, wash your hands, like if anything, to keep the bacteria away, any general bacterial virus. So it definitely has changed the way medicine is seen, I think, because it's so new, and knowing that there's always that potential for a new virus or a new variant of virus to pop up and kind of keeps everyone on their toes. So it's not anything that can say, well, it's just like the flu, or it was just like measles or chickenpox. It's a whole different type of virus that they just had to figure it out. And it's fortunate and unfortunate that it took this long, but that come with a vaccine this quickly, because most vaccines take years to come up with, to develop or design, because you have to break down a virus. Viruses are tricky. From my basic microbiology classes from college, viruses are a tricky organism to figure out. And so to break down a virus and figure out how it works and why it works, and the small mechanisms too, and then to figure out something to fight it that the human body can fight, takes a lot of education, takes a lot of time, takes a lot of research. So the fact that they've gotten a virus designed this quickly is extraordinary. I would definitely not see it as skepticism or something that was done wrong because it was done quickly. But it's more about, it's a testament to where medicine stands and where our technology stands. That something that would have taken 5 or 6 years to design 20 years ago now took a matter of months. So that's extraordinary. I think we should be praising the fact that we were able to get a vaccine this quickly and not downplaying it or saying there's something wrong or there is something that's going to harm us because it was done at a faster pace than we're used to hearing about.
Okay, we're going to pause that because he's got a couple of things that I want to go back to. But I want to talk to Mr. Williams. He's been in healthcare a long enough time to have known these changes that I'm going to talk about.
Okay.
Maybe 10, 12 years ago, your doctor used to have on a shirt and tie. Mm-hmm. And then it was found that, that tie is having germs on it. Right. And then we've had to evolve in that way. Dr. Curry's nodding her head as well. She remembered those days. But as far as the administrative side, we're mm-hmm. dealing with the insurance payers. Right. Here in Georgia, I was shocked to learn y'all have so many Medicaid payers. I was like, oh my gosh, that was new for me to try to wrap my mind around. Right. But are you finding that people are concerned about healthcare costs as the virus has taken place, and not in just your office, but in mm-hmm. your world, in the administrative world? What about the cost of healthcare? Do you think that plays a part of it?
Well, I do, but I think the concern is mostly for the uninformed. I'll say it like that. As far as it relates to COVID, with testing, with care and things like that, that has been covered. That is going to be 100% covered by any insurer. And that is, just due to the federal mandates and laws that they've put in place for that. Even down to the changes in business practices for like all the telehealth visits we're doing now. Those things have been lumped in to be covered so that there's no extra cost to do so. As telehealth existed years past, but there was an extra cost to do it. One of the things that I always talk with our patients who have any financial concerns about this, I'm very adamant about this, the insurance company works for you. You pay your insurance company. As a matter of fact, most people who get their insurance from their employer, their insurance company gets paid before they get paid, right? So, it is an interesting kind of dynamic because we'll have patients come in to say, well, you said I have a bill. I don't know. I don't know about this. I shouldn't have this bill. Why are you charging me this much? And then we pull the benefits and we look to see what is contractually obligated by the insurance company and things like that. And I'll say, well, ma'am, we need to call your insurer. They work for you. You have been paying them every single month. Now, there are contractual obligations like deductibles and co-insurance and co-pays and things like that. But when they just flat out deny something for no particular reason, we get right on the phone and call them and say, hey, I'm paying you an enormous amount of money every month. I'm not understanding why this is still my responsibility. So I do understand where the concern for the cost of insurance as it relates to COVID is, it's a concern. But I haven't seen any increase in costs for patients or anything like that. I do, however, want to mention that term, the cost of healthcare. I personally really do, believe that there is the third party that's in the conversation that's never really in the conversation again, and that's the insurer. It does not cost us any more than it did 10 years ago to perform an annual well woman's check. The doctor is not just arbitrarily sending out bills. What the cost is from your insurance company changing what is paid for, what isn't paid for, what deductible is there and what's not and what isn't there. And I think that sort of thing needs to be outside of our corona discussion, I do think that sort of thing needs to be addressed, and addressed by informed people. And to say, hey, insurance company, you have the patient and the provider arguing back and forth, but you're in the middle of this whole thing, not saying anything and getting all the dollars. So that's something that, we definitely kind of need to address after we get out of this dire situation. But, to answer your question, I have not seen any increase in cost for patients COVID related.
That's good to know. And Mr. Williams will definitely continue that conversation, because I'm on the negotiating end of some of that stuff now. And it definitely, the things that you're required to do as we go from one type to another is it needs discussion, and people need to understand what those things are. But we're talking about COVID. If you just joined us, we're talking about how it's affecting Black and brown communities. We're 3 times as likely to die, but we're also almost 2 times as likely to be diagnosed. And that's only the people that are actually taking the test. Now, I heard something that was kind of interesting, and it might be, just talk, but they were wanting to know, and maybe you, Dr. Curry, I'll start with you, and just as your opinion, your medical professional opinion, we understand that you're not infectious disease control or anything like that, but the question was, they were giving free tests out at my local church. Is that the same type of test I would get from my doctor's office? Meaning, is it better, worse, the same type? Could you address maybe some concerns with people that may go outside of their doctor's office to receive a test?
Right. So there are different types of tests to determine if you have COVID-19. There is the PCR test, which is typically the nasal test, where you do the Q-tip up your nose and it's a little bit of a burn and they send it off to the lab. There's also a test where now they can do it with saliva, kind of toward the back of the throat. They can do a swab from there. And then there's also the rapid test, which has become more commonly used in the last few months as it's been more available. The manufacturers have made it available. The differences can be in how long it takes to get the results. Of course, the rapid test is usually within an hour or less. The PCR test usually is more of a couple days to find out the results. Typically, the PCR tests we've seen are more reliable as far as if you're positive or negative. They're less likely to have a false positive or false negative test with the PCR versus the rapid test does have a little bit higher rate of having that. So if you're getting a test from your doctor's office or from your church, it's just best to ask what type of test it is. And of course, you'll know what they're testing, your nose or your saliva. And just ask them exactly what type of test and how long it would take to get the results. And that can give you kind of the best idea of what type of testing you're getting. Of course, in the beginning, there were a lot of labs who were trying to jump on the bandwagon of, doing testing because it was a financial gain for them. And luckily, the government came in and kind of ceased a lot of that. So we didn't have people getting tests from labs that were reputable, who maybe weren't doing the correct test and giving out false positives or false negatives. So I think that now we're almost a year into this, that they've kind of honed in on the best tests to determine positive or negative, and which labs are actually doing the job correctly as well.
Okay, Mr. Williams, and what are you seeing as far as, are you getting those type of questions? Are you having testing available for patients at your office? Or what are you hearing as far as, is there any concerns in the community you're in about the type of testing or which is better? Can they go to their community center, or maybe do they need an appointment to get a test? Right. What's the protocol here?
Right. So it's kind of been since, I guess, March of 2020. It's been a learning process for everyone. The testing. So here in our office, we don't do testing. We refer to the official testing sites that are all throughout the community. They have some that take insurance. They have some that are free for whoever shows up. Now we partner with Emory, who also partners with Peachtree Immediate Care, and they offer the 15-minute rapid test. And most of the people that I've come in contact with or our patients, most of them do the 15-minute rapid test. Although the PCR is, like Dr. Curry said, is more accurate, it does take some days to result. And the concern with that is you get tested on Monday, you don't get your results Thursday. Think about how many people you come in contact with then, and it's further exacerbating a problem. So, for a while, maybe in June or July, there was a logistics issue with the labs and the antigen and that kind of thing. So it became hard to get a test. But since then, tests are readily available. You can just, log on to any one of these websites, schedule your appointment, or you can go to some of these facilities that allow you just to show up. So the testing has gotten more efficient as far as logistically and how to do it. I haven't really seen any major concerns, especially in the last month or two in regards to testing. The bigger question, of course, is why we're here talking is the vaccine.
Okay, so we got through the testing, we got through some of the misconceptions, some of the fears that our community has. But on the testing side, I want to just stay there before I get to the vaccine. So, like with the flu, you can't have a fever. There's certain things that before, when it was egg-based, if you had an egg allergy, you couldn't do any of that. So who should be tested? And I'm going to start with you, Dr. Curry. And what should you be, give us an example of when not to be tested. Maybe that's how I want to put that.
Okay. Well, definitely we're looking at first if you have symptoms. The symptoms we've all heard about: loss of taste or smell, fever, the body aches, sometimes some GI discomfort. Those things, if you're having any of those that you don't have a true source for, you're thinking it's not the flu or something that's not sinus related, then that would be a reason to get tested. Or if you have someone has called you and said, "Oh, I tested positive," and you were just with them 2 days ago, then that could be a reason to get tested. There is that window of time when you are shedding the virus, and that window where you may be asymptomatic to those couple of days until the symptoms start to show up. So it's that small window of where you can be exposed and not know it and not have symptoms, and that's when you want to get tested. And even with testing, there is that area of time where the test may become like a false negative, where you may actually be positive. I have had people tell me, they've had symptoms and the test was negative. But it could have been that they got tested too early or even too late. So there is that window of time where the testing is most accurate, and that you definitely want to kind of know. So it's about that 2 or 3 day mark. If someone's been exposed, they may not have any symptoms, and then the symptoms may show up 2 or 3 days later, and that's the time where you want to get tested, and not wait 6 or 7, 8 days down the road where now you don't have enough virus in your system that it actually shows up on a test. So it's kind of knowing your body. Everyone knows when you don't feel right. Where you've been, who you've been around. If you've been literally in the house for 5 days, then it's probably unlikely you haven't been around anybody. It's unlikely that you may have been exposed to it. Could be something else. As far as those who should not get tested, like if you have seasonal allergies, we're coming to that time. It's very soon here in the spring where hay fever and allergies come in, and trying to know the difference between what's an allergy sinus related infection versus could be COVID-19 is key. And that's where it's key to just know your body, doing everything you can possibly to keep yourself healthy, taking your vitamins, doing the natural remedies to keep yourself healthy, so that if something does come in to attack your body, you're able to respond to it and able to know what to do with that. Oh, you're muted.
I'm sorry, guys. So listen, I wanted to take the first part of the segment to talk about the virus, to get that out of the way. Talk about some of the things that we've heard. Talk about the cost of it. Talk about, who should be tested before we got into the vaccine piece of it. I know all of us have been vaccinated at least once. Has anybody gotten their second dose? Okay, so we're going to talk about dose 1 and dose 2. We already had talked about the cost. I know here in Fulton County, you can just sign up. If you're in healthcare, boom, you can just go. There's not a big deal. They wasn't asking a bunch of questions. You filled out a half a sheet of paper. You got vaccinated. I want to talk about the reason why you should get vaccinated in general, and then I want to take it personal. I want to, I want y'all to give me, yes, y'all healthcare professional answer first on why you should. But I want to bring that thing all the way back home. Why did you make that decision? And what was it like for you to decide? Now, we know when things are developed, we typically have clinical trials.
Right.
On a normal day, we might be in a clinical trial for years. Okay, there, people will be paid to be in these studies, and it will go on. It can go on for a long time, depending on what discipline you're in. But this was developed relatively quickly, approved by 2. We've got other people right now having their version of this. So I wanted to ask the question, why you should be vaccinated. And I'm going to start with the ladies. Dr. Carey first, and Mr. Williams, you follow right after that.
So the biggest thing with being vaccinated is I see it as our only way of really getting out of this pandemic. Vaccine can provide herd immunity. If the majority of the country, the world can get vaccinated, then we can try to not so much eradicate the virus, but get it to a point where it's under control. Because there are those who just cannot get the vaccine for the different health reasons. So for those of us who can get it, I feel that we should. And I did not research as far as how the vaccine was made, and the mechanism of the vaccine is not new. It's been around for a while. It's been used on other types of vaccines. It's a matter of plugging in the numbers of COVID-19 to an mRNA type of vaccine.
Right.
And then knowing that it's not the virus itself that you're being given, and the vaccine is similar to the flu vaccine, which is the virus itself. The COVID-19 vaccine is more of a shell of the virus. And I've explained this to some people as it's your body's way of recognizing a dangerous person. We all have watched horror movies, and we know the things that the person who walks around with the big black coat on and the shades, and you're automatically your senses heightened, like this person might be dangerous. I don't know. And so that's kind of the vaccine it's your body's way of saying this thing is dangerous. I'm going to give you the coat so you can recognize the dangerous person, but not the actual person, not the actual serial killer. I'm just giving you the coat to recognize the serial killer. So that way, if I'm ever have the vaccine coming my way, I'm exposed to it, my body has already seen the coat to the serial killer. So my body can say, we've seen this bad guy before, we're ready to fight it. We have all the things we need to fight it. So for me personally, I have 3 kids who are all in virtual school right now because of the county's mandate. But in my exposure in being in a hospital and being patients, my office never closed. When the pandemic, everything shut down, we stayed open. We cut back on our patients, our older patients that we saw, but we never closed our doors. So my exposure has always been there. I have to go in for emergencies. I have patients who have to go into the inpatient to see. So knowing my risk of exposure was one of the main reasons why I wanted to get vaccinated. The other part of it is that I have an autoimmune disease myself. So even though I feel like I'm healthy, I know that deep down, if something were to happen, I don't know how my body would respond to COVID-19. And we see it all the time. People who we think are healthy, we've seen the stories, a 19-year-old, a 25-year-old, a 30-year-old, who everyone thought was healthy at the top of their game, COVID takes them out. And, it's just one of those things where it's not a gamble, a risk I was willing to take, knowing that I have 3 small children that need me, and a husband that wants me to be around. He's fortunate, has a job, he can work from home, so he's able to not be exposed if he doesn't need to be. But I don't have that luxury for the job that I do and what I signed up to do. So that was my reason for getting vaccinated personally, was knowing the unknown, essentially. Knowing that there are things that can happen to me that I have no idea. Even my autoimmune disease, when I was diagnosed with it 2.5 years ago, it came out of nowhere, absolutely nowhere. And the doctors have no idea why it happened. Now I do a monthly IV infusion to keep it under control, but it's no way of knowing why it happened. And so when I knew what happened to me 2 years ago, I said to myself, what if I had a COVID-19 infection with an autoimmune disease that's nerve based, and knowing that COVID-19 has nerve implications, it affects the nervous system, I could really be in a lot of trouble with that. So I felt the risk of vaccination was far lower than the risk of contracting COVID-19. Once I laid everything on the table and really looked at it.
Very good. So I'm sorry, Deshaun. I didn't hear you.
Go ahead.
Oh, okay. So for me, so like COVID-19, it has tested our outward ability to empathize with our neighbor, in my opinion. When you think about the masks, when you put on a mask normally, whether it's a football helmet or whatever, you're protecting you, right? This mask is protecting my neighbor. This mask is keeping my droplets to me and protecting someone else, right? And with the vaccine, and speaking to what Dr. Curry said about herd immunity, that is the number one reason why you should take it, because COVID needs us to continue to thrive. It needs humans to continue to pass through. If you stop it from passing, it's no longer. And so that's why I currently believe that you should get vaccinated. I also I had to do my own research, and I found out that both Pfizer and Moderna vaccines use mRNA, and they're not using an attenuated or weakened form of the virus like the flu virus. So it's not possible to even get it from the vaccine. And here at our office, we we partner with two of the major labs, right? And I just kind of think about the advances in technology since I've been here. We can now tell the sex of the child at 9 weeks of gestation. At 9 weeks, I can tell you if you're having a boy or a girl. And when we compare that to, we always hear comparisons of COVID and the flu. Well, let's compare what was going on when the flu vaccine was created. You were determining the sex of the baby at birth, And so these things with biotech and the things that have the advances in technology, whether it's consumer electronics or biotech, we have all seen, technology just spring forth by leaps and bounds. So the speed at which the vaccine was created, to me is par for the course, and I'm excited to see what can happen in the future with this technology. I also, for me, it was extremely personal. I think about 9/11, where 3,000 people died that day, and God rest their souls. But we have been seeing 3,000 people. We've had a 9/11 every single day for months. Every day, more than 3,000 plus people have died. And one of those people was my uncle. My Uncle Al passed from COVID-19. His wife, she's a healthcare worker in a long-term care facility. She didn't feel too well. She pushed through. A couple of days, he started experiencing symptoms, and he didn't do well. And it hit close to home. It is still tough to talk about because this is something that could have been avoided, in my opinion. There are some communities down in South Georgia that just are anti-maskers, and he happened to be in one of them. So like I said, it was a very personal decision for me. So that's my decision.
It's very hard to hear people talk about losing someone close to them under any circumstance. But when we're talking about over 400,000, you almost can't wrap your mind around that kind of number.
Right.
It is a number that just is so staggering. And then when you go to the CDC, it'll have like plus 4,000 other ones as the count hasn't rolled over for the next day.
Right.
So you know that there is people dying literally 1 in 12 or 1 in 13 or whatever they've got it down to now. And you guys both said a buzzword that we hear all the time, which is herd immunity. So I want us to just clarify what that is, what that means, and because once we start talking about it, we'll start remembering that in our childhood with the chicken pox and things of that nature. But Dr. Curry, just tell people who may not know what that means, but they may have heard, what is herd immunity?
So the most basic sense, herd immunity is when the majority of a population is immune to a disease to the point that it's not affecting the people around them. So if the majority of us have taken the vaccine and cannot contract COVID-19 or not have the negative effects from it, then we're able to protect our neighbor. As Mr. Williams said, we can protect those who are around us. Because like you said, there are those who cannot get the vaccine. There are those for whatever reason can't get in. So we have to protect those and the children as well. We don't know how COVID-19, the vaccine affects children. That hasn't been studied yet. So it's not being pushed for children to get vaccinated just yet, from what I've read. So we want to protect our kids. And so if the adults of this country can get on board with getting vaccinated, then we can hopefully protect the children until it's known for sure how the vaccine will affect them. So herd immunity is really just about a large population having the majority. I don't know if there's a percentage or a number to put on it. It's 80 or 90%, no particular number. The majority of the people in that community have already been exposed to the virus or have been vaccinated to the point where they cannot be a danger to the person next to them.
Yeah, Mr. Williams, I'm going to ask you this question. We've all been vaccinated. We know what the process is. You had told us about the cost. There's several different sites that we can go to sign up. But tell us, you did your research. You decided this is what I'm going to do.
Mm-hmm.
Now, you're walking in there. Tell us what it was like going in there, getting something. Now I'm going to talk to you like, your people going to talk to you. You don't know what they getting ready to put in your arm.
Mm-hmm. So after I made my decision, and one thing about research, I got to make sure I say, when you're doing your research, evaluate your sources. Get your information from a reputable, whatever, it's newspaper, internet, wherever, but make sure it's reputable, and then look to see where they got their information from. I can't count the number of times someone's quoted a meme on Instagram as facts, and it's like, come on now, y'all. But after I did my research, I got my vaccine at Fulton County. It was very easy. I just signed up. When I arrived, my location was Mercedes-Benz Stadium. I'm a huge Falcons fan. It was kind of crazy. My first time back at the stadium was to get vaccinated, but it was cool. The process was very smooth. I walked in, signed my consent. They called my name, got my shot, waited my 15 minutes, and left. The whole process took 30 minutes tops. It was not a lot of bureaucracy. It was not a lot of this. It was everyone was trying to make sure the process was smooth, and I appreciate all the volunteers who are helping to do that.
Now, I'm going to, before I go to you, Dr. Carey, I'm going to stick with you, Mr. Williams. So tell people the reason why you have to wait 15 minutes before you leave.
So you want to make sure you're not having any adverse reactions or anything like that. There have been some reports of people who have serious allergies to things. that they have an allergic reaction to the COVID vaccine. I want to make a point by saying they also have allergies to all the other vaccines and everything else. Here in Women's Health, we administer birth control by depot if you'd like it. If you like the depot shot, you can get it. But if you have an allergy to Baker's yeast, you're going to have an allergy to this shot. So those things are, there are risks. And they have you wait 15 minutes to make sure everything is fine. The CDC also offers a program called VSafe, which texts me every day. You say, hey, how you doing? And you tell it how you're doing. If there's any adverse reactions, they get you where you need to go. I have had none.
Awesome. Okay. Dr. Carey, now I want to talk about the actual injection itself. Now, there's lots of people that are nervous about needles. They don't like any type of injection. And what should that person expect when they go in and pull their surgery off?
So this injection is given in the deltoid, so right at the shoulder level. So they're going to find the part that's the most muscle or medial part of your muscle in your shoulder, and find that area to use for the injection. And that's because of that. They want it to be a muscle, so that's going to absorb the vaccine the best and get into your bloodstream and be able to do its job and go where it needs to go. I will say in my vaccine experience, mine was a little bit different. It wasn't quite as seamless. My first injection, the first round, I got mine through the hospital through Emory, as a physician through Emory. And they did make a point of saying that because the vaccine is going to produce an immune response, it's best to maybe wait till you have some days off from work or not have to be, do a surgery, a major thing the next day. So because you don't know how your body will respond. You may have actual COVID-19 symptoms, fever, chills, body aches, all that kind of thing. So I waited to get mine until just before Christmas because we were going to be closed for 4 days, at Thursday, Friday, and the weekend. And so I just wanted to make sure that I was going to be able to get home and not have any issues where I would have to be out from work or make the staff or patients nervous because of reactions I was having. So I got mine done on the 23rd. And because of my autoimmune disease, it actually flared up my autoimmune disease and my body's response to that reaction. And my autoimmune disease creates pain in my torso area, so my back and ab muscles get really tight. And I had recently had an IV infusion that Sunday prior, and so I was doing great. And so when I started feeling symptoms, I was like, this is probably a reaction to the vaccine. This is my body's way of building an immune response. And for about 2 or 3 days there, I was on pain medicine around the clock, trying to keep my autoimmune reactions under control because I knew exactly what was happening. And so it took about 4 days for me to kind of get back to normal. And so by that Monday, when it was time to go back to work, I was actually okay. I was probably 80% back to normal. So I was one of those where I didn't have the COVID-19 symptoms, but I had other symptoms related to the vaccine. And so when I tell people about my experience, I always let them know that just be ready for what could happen. You can have absolutely nothing happen like Mr. Williams and be nothing and be perfectly fine, or you could definitely have symptoms. And I've had friends of mine who've had some of the other symptoms that they've related for about 24 to 36 hours afterwards. The fever, the body aches, the chills, all that, and just some Tylenol or a heat wrap, and it goes away. And I have fortunately had my second round already, and that one was perfectly fine. I had a sore arm similar to having a flu vaccine. I did a heating pad on it. I took a Tylenol, and it was fine after a day. And I'm a week out from that now, and I've had no other issues with it. So I think on the one hand, I was nervous, of course, to going in for that vaccine for the unknown, not knowing how body would respond to it. But I was also excited for the thought of I could possibly, of course, contributing to herd immunity down the road, but knowing I'll keep my family safe was
Right.
the biggest thing for me. So I was willing to take that risk at the second round. The second round's coming up. My date's coming up. I'm getting reminders, emails, text messages. I was nervous for the second round coming up, ready for pain again, but thankfully I didn't have any reactions the second round.
Well, I want to say too to everybody that the most common thing that happens is just a little bit of tenderness at the injection site. That is the most common thing that people have noted happening. However, everybody's body is differently. Reacts different, but that's not like hearing Dr. Curry's story shouldn't be like, well, that might happen to me, or hearing Mr. Everybody's going to react different, but the most common thing is just a little bit of soreness at the site of the injection. So we talked about Mr. Williams. Have you had round 2 as well, or just the first?
No, I'm just the first one. My second round is coming up in about 6 or 7 days. And like Dr. Curry said, there was a level of excitement. And I don't know if excitement is the right word, but it was just like being a part of something that can help it was about the greater good. And yes, the story about my uncle, I was thinking about my children as well. I don't want to bring this home to them. But I also don't want, I want to help with herd immunity so that nobody brings it to my mother or my father, or, the at-risk 65 or older, or anyone, you kind of get overwhelmed with that sense of, I don't know, is it a sense of duty, a sense of excitement, or something? But it does, it felt good to do it.
Yeah, I mean, we all got in healthcare for whatever reason, but at the core of it is to help. And so I really feel like when you look at what you're doing and why you're doing it and the greater good for the people around you, it's almost not even a question of what we're doing. And then there's a trust level too, because you work with doctors and nurses and medical professionals, and you can walk over to the lab or pick up the phone, and people that are at the helm of this thing. That lessens the anxiety that we may have when we are choosing and making a medical decision, because we're around it every single day. But let's talk to those people that aren't in healthcare. Let's talk to those people who don't have the same information. Mr. Williams said something amazing. Know your source. I mean, know your source, because there is misinformation almost as much as there is the right information, and trying to decipher who's telling the truth about what. We all know about non-vaxxers. I mean, there's kids right now that parents have made the decision for them based off of something they might have read or something that they might have seen or something like that. But I want you to appeal to our community. Dr. Curry, I'm going to always start with you, and knowing what you've seen, and knowing who will listen to you, and knowing that maybe they're going to share this with their aunt, sister, cousin, and brother. Let them know what you want them to know about this vaccine, this virus. And if they're on the fence, like, well, maybe I'll wait till next year, whatever their situation is, let them know, what is your appeal to that demographic of people?
So my appeal is simple. COVID-19 kills and it maims. Even if you don't die from it, you may have long-term effects, what they're calling the long hauler. You don't know if you'll be that one who will recover and have no problems. So why take that chance? It's not worth it. I say that similar to how I talked to my father before he passed with his diabetes. He was always, well, something's going to kill me, something's going to take me out. I said, well, diabetes may not kill you, but it's going to affect your way of life. It'll be the one thing that'll stop you from going fishing or stop you from doing what you want with your friends. Don't let the fear of a vaccine put you in a position where you are affected for the rest of your life by something else preventable. COVID-19 is preventable if you vaccinate. We can't stay in mask and in the house forever. This economy is not gonna last that way. People aren't gonna last. We're meant to be around other people. We're meant to be with our families and being able to have big family dinners and holidays together. And no one wants to do Christmas and Thanksgiving in 2021 like we did it last year. No one. I know it was very different. I would have loved to have great family dinners and be around cousins and friends, but it just wasn't safe. And if we want to get to a place where we're back to those great activities and being able to travel like we want to, or go to Disney World, or go to the park, or go skating and just be free, have that true freedom that we're used to having, the vaccine is our best way to get there, our best and fastest way. Because at the rate we're going now, people stay afraid of a vaccine, more afraid of a vaccine than they are of the virus itself. We're going to be years before we get back to where we want to be. And so that's my biggest appeal is, if you want any resemblance of how your life used to be on the social side of things, or even on in your finance way, if you were someone who worked in hospitality, hotels and hospitality, that industry is taking a hard hit. And if you want to get back to that, or I have my sister-in-law is a baker, and she used to work for a hotel, and they haven't had an event at their hotel since this all started. So she's essentially been unemployed. She can't do what she loves, which is bake for people and have weddings and have conventions. And if you ever want to get back to that, what you love to do, and everyone be in a place where they can love what they're doing and not being forced to do something just because they have to put food on the table, forced to do a job that they don't love just because their true passion isn't available at this time, then please, I would definitely encourage you to get vaccinated. And on the medical side of things, where I see my patients with the comorbidities, you have to think about the rest of your health. We just don't know how COVID is going to affect if you're diabetic, or if you have a history of cancer, or if you have hypertension. We just don't know what COVID-19 will do to you in addition to those things. So if you have any of those diseases, or if you're on any medication for any disease, getting the vaccine will help you to be able to have only diabetes and manage that, and not have to think about diabetes and the ramifications of COVID-19, say if you were to recover from it, the lung issues and the breathing issues that come along with it. So that's my plea to the community, is think about yourself, and think about your neighbor, and think about how this virus has done so much damage on so many levels to our community, our economy, and just our way of life. And can consider more than just yourself when you think about getting the vaccine.
Mhm. I would definitely echo that last statement. Consider more than just yourself. I think we have, I don't want to really get into the debate about politics and and things like that, but we have just been bombarded with the me. Everything is about me from top down. I would definitely say consider more than just yourself. I would also, and I've had this conversation with a lot of my friends who have questions about disproportionate effects on brown black people. I would say consider this. You can have all the financial, all the money, all the power in the world. You're still out of sickness, right? I don't know the phases of the distribution of the vaccine. Our healthcare providers and essential workers are getting it first. So there's a reason to kind of question that, because they're giving it to some of the most essential workforce that we have. So I just implore everybody to do their own research. Their informed decision allows them to choose to be vaccinated so that we can all get to some sort of normalcy. I don't like leaving here, going home to play with my twin boys that are 2 years old, worrying about maybe I should breathe this way while I'm holding them. You know, we want to make sure we get out of this, and the only way to do it is to do it together.
Okay, guys, we've talked about it. I told you it was a critical conversation today because this thing is deadly. We told you about what the virus is. We talked about some of the misconceptions, some of the fears that have been carried over from the past. We even gave our actual feeling of going in and getting vaccinated. And Mr. Williams said it best just a minute ago. They're giving it to healthcare essential workers first, one of the most critical people that are actually fighting for people. And so we want you to be informed, do your research, but get it from a reputable source. We have to trust at some point. We have to trust that we're not being experimented on. We've got to lay that aside so that we can get back, as Dr. Curry said, to what was normal to us, to the things that we love, to hugging our family and friends. We are a social society. So being in the house, we don't want to do that again. So we implore you to go to the websites, CDC websites, your local and county health departments, and you start there. Start there with your research there. But when you're making a decision, Mr. Williams said, don't just think about you. Think about the other people around you, people you have in contact with. This is community social justice. We want everybody to stay safe, stay well. We want you to become vaccinated so that we can get back to loving on each other, being good to each other, and just being good in general. So thank you, Dr. Carey, for being with us. Thank you, Dr. Williams. I can't wait to get to know you a little bit better. And for now, we'll see you next Friday on Community.